Heavy rains pound the mouldy structure of a hospital in Malakal, South Sudan. There is no power and no glass on the windows of the hospital wards, like this one where mothers struggle to shield their small children from splashes of water and gusts of wind. The poor state of health facilities across the one-year-old nation shows there is great need for the country in its first year of independence, which was marked with celebration in the capital, Juba, on Monday the 9th of July 2011. South Sudan successfully divorced from Sudan last July, but has pitched from crisis to crisis. Corruption scandals, violent border confrontations with Sudan, and the shutdown of oil, its only source of foreign exchange, has crippled the government's ability to improve life for its citizens. Nyataba Lamkit was caught up in recent ethnic fighting in Akobo. She was shot and lost her leg. With only a small clinic in her village, she had to travel 3 days to the hospital in Malakal.
I was rescued after I'd been shot by a raider from Gachchuk. He came from his village and found me and another woman. He killed the man next to the woman and he shot me. I stayed lying down, but the other woman ran to another village where there were soldiers. I laid my daughter, who was breastfeeding, on my chest. The raider then speared the man next to me, but forgot about me and left. After a while, the soldiers came and rescued me.
For a population of nearly 9 million people, there are only 120 medical doctors and just over 100 registered nurses. Nyantaba is determined to get better so she can care for her children.
God saved me because I have small children and one older one. As long as I am alive, I will be with them. I'll be given some crutches so I can sit with them. If I need something from outside, my husband will bring it for me. And I have a brother too. They will help me. When my leg has recovered, I'll be given crutches and my children will be able to sit with me. They won't sit with another woman.
Others like Nyataba are facing life-threatening circumstances every day, with a security risk at home and only basic health care in hospitals across many regions of South Sudan. Experts say the situation has deteriorated despite independence. Hospital admissions are up 30 to 40% compared to 12 months ago, and with an even greater increase over the past 3 months. Medical teams also say patients are arriving in much worse condition. Children are the biggest casualties of fighting and are at the highest risk. Food is scarce and expensive. Malnourished children are particularly vulnerable to the main childhood killers: pneumonia, malaria, and diarrhea. Dr. Giorgio Monti is a consultant pediatrician who has worked at Malakal Teaching Hospital since January. He has seen the effect of fighting on young South Sudanese after the border closed, preventing food reaching the market.
Unfortunately, in the last 3 months, there was some problem here, just 20 kilometers north in the border, when they started fighting again. And immediately they closed the border. That means there is no food in the market. The few foods we have is really expensive, and we immediately saw an increasing of number of malnourished baby.
The day before we planned to bring my daughter to the hospital, she died. My other child was alive for 4 days after I gave birth, and then she started to cry. She died on the way here.
South Sudan also records the highest maternal mortality rate in the world. Doctors here say they cannot cope because there is such an acute shortage of supplies and facilities.
We have no power 24 hours a day. We have no good lab. We have no radiology. We can have enough drugs, but even the supply of drugs is not so easy. And the big problem is the lack of education. Lack of education in doctors, because we don't have university, we don't have school of medical here, and we don't have school for nurses.
Independence has failed to end violence both inside the country and on the border with Sudan. In April, South Sudan's army occupied an oil-producing region also claimed by Sudan, bringing the countries close to a new war. A few months earlier, the armed forces failed to prevent cattle raids between warring ethnic groups that killed hundreds of people.